antisepsis class, first of all, if we find any patient on the street, so for that, on the wound, for first aid we can just use water and a gauze of any material and just wrap it with a bandage, and then
This is
recommend
to prevent the bacteria from the skin to go inside.
and to prevent bleeding as the first aid. So we take it, and then we recommend the patient to go to the admission department. In the admission.
Oh, but water cannot use if it's bleeding. Yeah, that's what he said.
Water cannot be used if it's bleeding. You just bandage it.
Yeah. Okay.
And then the patient goes to the admission department, does the registration, and with all the details about the name, age, gender, where is the localization of the wound, how, and then what was the cause of the wound, and then the receptionist will write the place, for example, to the surgeon. So the patient goes to the surgeon. There, the patient already has the form of the admission department with the information, and then the doctor would again ask to confirm like the name, age, the localization, and how the wound was caused. Then the doctor will examine the pulse, the vital signs, the respiratory rate, and the blood pressure. So for example, if these vital signs are not normal, so the patient would be admitted to the inpatient department. Since it's normal, so then we would ask the patient for any history of allergy or diabetes. If not, then we start the manipulation. So the manipulation consists of, first of all, physical, which consists of irrigation, and irrigation has in irrigation we use hydrogen peroxide and we put it in a syringe. Should we show it?
Yeah.
Yeah, let's show it.
Was it?
It's the. Silver.
This one?
I think it was this one. This one. And then.
That won't work. We teach us a different way than
We can use hydrogen peroxide or potassium permanganate.
Or saline solution.
Or saline solution.
So with the pressure,
This is called the high pressure irrigation, right? Oh, but we should have drips over or something to
avoid spilling.
Yeah, spilling
And then
on our
within sorry, a lot of pressure, we put hydrogen peroxide, and then this is physical irrigation. It removes the bacteria or the contamination and dirt. After that, what we do? Irrigation is done. So the chemical is already done since hydrogen peroxide is used. Then
apply local anesthesia and deployment. Or else this is gonna hurt.
yeah, if the wound it has, but this is not that wound.
But still, it's written that
We can show here. For example, if the wound has like debridement or necrotized tissue, so we need to cut the necrotized tissue, and it should be like
Clear
very
cut.
even and not like zigzag. And then after that we take the tube. take the tube, and the tube should
Oh,
be
that
inside.
is a mechanical.
Yeah. This tube should be cut from in between. If the wound is too deep, we can put inside, or either if it's shallow, we can put above. Then this this kind of antisepsis is mechanical, which can be divided into two types of draining, which is active and passive. In passive, we just use the method of gravity, and in active, we can use a suction.
You have to press first. Before you put, press.
We press and then we put
These
inside.
have to be attached to it.
And since the tube is not of the same size, we need to attach it with something. After that, when it's been applied, hold it. We again use the gauze which has hydrogen peroxide, treated with hydrogen peroxide, and then
Just describe.
so we can wrap it with the bandage. Now, since this will be hanging around, so we need to put it here, and we can just tie it
And use a
sling bandage. So
But
we
actually
just
when
take it
when we do
and we
this-
just tie it. Yeah.
When we do this, we have to wear gloves and stuff. Just
Actually, that videos are already there, so I think that's why he didn't teach anything to us. You remember? No gloves and so yeah, it's been tied, and then for support we use.
We can use a sling or triangular bandage.
No, it's already sucked and then yeah, so we can tie, and then we prescribe then we write the manipulation, the treatment we did. If we have a camera, it's not needed. Then since this is exogenous, so the bacteria would be positive, gram positive bacteria. So according to that, from this table we can see this these three are gram positive. So then we can prescribe penicillin, because they have spectrum for gram positive bacteria. And then we can tell the patient, and we can
the prescription. This is for our records.
and then we give the patient another prescription, and we can provide
The medication.
yeah, and then we instruct the patient to come next week so that we can analyze if the infection has spread or not.
Also, we have to give like a painkiller.
Painkillers and just
It's there.
Examples of antibiotics. Oh, and we already about tablets and the.
yeah,
It's
if
better
it's
to-
outpatient department, we orally recommend the patient to enterally to take the tablets, because it's easier for the patient, and intravenous and intramuscular are not needed. And yeah, the patient is good to go now. And come next day, and we and come next day. The patient comes next day, and then we do again. We just check for the observation, and we'll check if we need to change the dressing and all. So